Hi, I'm Kristen, and I'm a pregnancy coach who works with mamas all over the world. I help you go from overwhelmed and anxious to enjoying your pregnancy, preparing for a sacred natural birth, and giving your baby the beautiful beginning that you dream of. Today, let's talk about how to adapt to changes in your birth plan, because this is one of the things that moms really worry about. I'm planning a natural birth, but what do I do if something comes up? Does that mean it's going to go all out the window? And sometimes moms are resistant to prepare for natural birth or to have a birth plan because they worry about what happens if it just ends up not mattering. But the truth is that it can matter. It does matter. Birth can bring the unexpected. I've had 8 babies myself, and I've literally worked with thousands of women for over 17 years at this point. I have seen a lot and know that birth can be unexpected. In fact, I've been able to assist at over 24 births myself. So it's important to acknowledge that birth can sometimes bring the unexpected, but you can do so much to prepare for a birth, both preparing so that it goes exactly like you dream about in your birth plan, and how to handle it if things aren't going quite the way you want them to. The first thing to do is if something seems to be coming up that isn't going according to your birth plan, so to speak, ask questions. Sometimes a care provider might say, okay, well, I think this is going on, so this calls for a change in your birth plan. And sometimes what you should do is say, okay, can you tell me the pros and cons? And sometimes the right question to ask isn't necessarily the pros and cons, though that might be the first question that you ask. The next question to ask is, what happens if we wait? A lot of times there are pros and cons, and your care provider is used to talking about those, but they don't necessarily talk to you about, okay, well, waiting. In the obstetrical world, the technical term for that would be expectant management. Sorry, trying to get that off my tongue. So expectant management is where you just kind of watch and wait. And for the most part, that's okay to do. There are also some things that we know. For example, continuous fetal monitoring. Something comes up on the fetal monitor, everybody is distressed. Well, reality and research say that those things actually don't ensure good outcomes. But something you can do if something comes up, if you are having continuous fetal monitoring, is you can change positions or see how baby responds to that. So often there are things that you can do before you rush off into an emergency situation, and sometimes just waiting and seeing is a valuable thing to do. And oftentimes it's just as safe as moving into an intervention, or perhaps even safer. So asking what happens if we wait, asking those questions, even if you need to ask questions briefly. There are very few things that are legitimate emergencies that require you to jump into action right there. Most of the things are okay. Oftentimes, even when they decide, okay, we need to do a cesarean, they'll still take 30 minutes to get everything prepped. So that wasn't an emergency cesarean. An emergency cesarean is where they have to get you on the table, and where there are a couple of things in birth that can warrant that. Most don't. So oftentimes you can wait, or you can try something new, like getting up and changing positions and moving around and that sort of thing. So changing positions actually is the next thing to do when things seem to not be going quite right and according to your birth plan. For example, the dreaded failure to progress, when labor just isn't moving along the way that you want it to. Sometimes a change of positions can really help. Sometimes getting some rest can really help. So thinking outside of the box to what can we do, or what haven't we tried? Sometimes moms in labor are exhausted and hungry, and having something with quick energy can really help you. One of my midwifery professors, Gloria LeMay, talked about, go down the hall to the soft drink machine and bring that mama a soda so that she gets some quick energy and see what happens. I think she was talking about an instance where a mom was just out of energy to push her baby out, and they gave her some sugar, and surprise, surprise, she had some energy. So it's just like you wouldn't expect, say, a marathon runner, they're running and running and running, and they have stations where they have those gels and stuff, right? You can tell I'm not really a runner, but they have those things for them to be able to get that quick nutrition, that quick carbohydrate, that quick glucose into their bodies. And those are things that you may need as a mom as well. So think outside the box. Would a position change help? Because sometimes baby isn't moving down because baby isn't in an ideal position. And a position change can help get baby into an ideal position. Or getting baby backed off the cervix by saying going to a chest to the ground position where you're on your hands and knees and you put your chest down. It helps baby back off. Or even a side lying position on your left side can help bring baby off the cervix a little bit. And then you can get up and try and get baby more optimally positioned. Mexican midwives have pioneered the use of the rebozo shawl. which can help do the same thing. Birth balls can help move babies down. So what I'm saying is, if something unexpected comes up, like labor isn't progressing, or you're feeling tired or out of energy, just tapped out, sometimes simple solutions can help with making your birth plan get back on track when it feels like it's derailed. And then again, even if it's brief, calm discussion can help. And if it turns out that there is an emergency situation where you need to totally change up your birth plan, one thing you can feel confident in is if you have calm conversation and collaboration with your care provider, even if it's just very briefly because of the nature of the situation, you will feel much better. And at the end, there may be some grief because of what you lost, but you will also feel that sense of collaborative care, that respect, and that dignity from having worked together with your care provider and made a collaborative decision rather than feeling like that power's been taken away from you. So those are some tips to work with when you feel like your birth plan may be going off track or things aren't going quite right. What can we do to get it back on track? Or what can we do to feel that respect, dignity, and collaboration to help accept when we know that something needs to change? Like I said, I work with pregnant moms all over the world, and if you would like to have an enjoyable pregnancy where you stay low risk and you prepare for a smooth, safe birth experience, I would love to walk alongside you and support you in that. Head over to birthbabylife.com/beautiful. Let's talk this week about how I can help you give your baby that beautiful beginning that you're dreaming of.